The news tonight, health officials say two of the largest issues here in Oklahoma during the vaccine rollout is accessibility and hesitancy. But they hope by solving one, they can solve the other. NewsChannel's Jamison Keefover learned how some people are waiting to take the vaccine or don't want it at all. Jamison.
Yes, Mark, there's so many different reasons why someone doesn't want to get the vaccine. I've heard from religious to cultural beliefs, distrust in the system, or even just a disbelief in vaccines altogether. But officials tell me they're trying to educate people what it means to get the vaccine or not get the vaccine and how that impacts Oklahoma. Some Oklahomans making the choice to not get vaccinated for COVID-19.
And the reason why I really won't get the vaccine is because this virus is about hygiene.
Castellano saying he hasn't been sick because he's taken precautions against the virus, like washing his hands and social distancing.
I don't believe that I need a vaccine to make sure that I'm okay because somebody else isn't, is not hygienic.
There are many reasons why Oklahomans are deciding against the vaccine. Misinformation online leading to some vaccine hesitancy.
It can be a real problem, and it is much more difficult to counter half-truths and innuendos with real truth in a sense.
A small percentage of unvaccinated people won't have a heavy impact on herd immunity, but it can still cause harm.
For people who have had COVID, people who get vaccinated, and people who are about to get COVID. So if people continually refuse to get vaccinated, eventually they will also become immune through infection. And okay, that's their risk, but the difficulty is once they get infected, they can also spread it to their loved ones and other people.
Not being vaccinated can cause other issues for people. Some countries requiring the vaccine for travelers.
We have a house in Italy, and if they require a vaccine to come into the country, then I'm going to sell my house.
Officials hope to increase vaccine access to groups across Oklahoma. That way, less people will be hesitant to get it. Dr. Drevitz told me they're working with multiple groups to get that education out to people in different languages. That way, that education effort actually is effective. Live on Lookout Mountain, Jamison Keefover, News Channel 8.